I have quite a good number of fond memories in my interactions with TEPHINET. I think one of the goals at TEPHINET, I think, is really putting to practice is bringing all these field epidemiology training programs that are all over the world and all trying to teach the same skills together. Because I think like one of the things that we've realized over the years that field epidemiology training programs are more than just technical training. They also come down to building networks of professional, building trust amongst regions and countries. And I do see that as one of the key roles that TEPHINET has been taking up as well. And unfortunately, it's often an underestimated role. It's a role that you can't always easily measure. It's much more easier to say these are the number of programs that we supported, or these are the numbers of trainings we delivered. Yeah, but it's something that should be greatly valued. I had multiple hats on in the periods that I have been working with TEPHINET. My first hat was as the president of the EPIET alumni network. That's it's in the name. Basically the network in Europe that consists of programs like EPIET, UFAM, that's the lab brother of the EPIET program, the German FETP, the PEA program, and the UK FETP, and since recently also partners in the MEDIPIET programs. And I think one of the nicest interactions was to kind of make sure that we also within TEPHINET that Europe was strongly represented and many of these global stakeholder discussions. And it's a role we kind of happily played also as a network with strong technical capabilities, but also very much trying to put in practice that whole social part of a network and a trust building type of exercise. And I remember this very clearly from one of the regional conferences in Laos, with TEPHINET and organized, of course, by the partners of SafetyNet, where quite a bunch of people from all over the world, and especially the region, came together to speak about emergency training. And in the meantime, when we had that meeting, I think it must have been 2017 or maybe 2018, much has happened. The pandemic has come in between. Multiple other public health emergencies of international concern have come past the revenue, and it's good to see that nowadays we're really trying to realize these types of emergency trainings with the global landscape of partners, not just the field epidemiology partners, but also external partners such as WHO, GORN, MSF, many of the national public health agencies across the world that are trying to put their heads together and kind of make sure we don't duplicate too much, but we kind of generate content together that we can deliver to different graduates and people that haven't completed the field epidemiology training yet.